All right, now sleep apnea in kids is usually tonsils and adenoids and blockage. But in adults, it turns out that the throat muscles, they're involuntary muscles, so it's not like you can work them out and go to the gym and work out your throat. They get floppy and they'll close down. Now, sleep apnea was first diagnosed or as a syndrome in about the late 70s with very obese people, and they noticed that they stopped breathing. But sleep theories and sleep information is relatively new. It's, I think, about in the mid-60s, they started looking at sleep and seeing that sleep had an architecture and that there was. So in the late 70s, they realized that really morbidly obese people stopped breathing. Now, now in 2006, we realized that lots and lots of people have sleep apnea and stop breathing while they sleep, whether they're thin or fat. Now, overweight people have a tendency to have it more than underweight, but I see many thin people have it. And as you're sleeping, the throat collapses, so you stop breathing from anywhere from 10 seconds to, I had a fireman and he'd stop breathing for 4 minutes, start to get brain damage. And what happens is they don't even know they've stopped breathing, because what they don't do is in deep sleep, everything relaxes, so their throat collapses. And so the body kicks into panic attack to open the throat, and to open the throat, the body brings you up out of deep sleep to a lighter sleep, but not to awake. You have to be awake for 30 seconds to have a memory of it. So all night long they wake up, they breathe, they try to go back to sleep, and they don't breathe, so they wake up. So they're doing this all night, so they never get rested. Well, the gold standard of treatment for sleep apnea is a CPAP, which pushes air down the throat, but many people have a lot of problems with it. So what we can do in dentistry is I measure the throat with a breathing machine, very easy. It has it's a sonogram, and it goes down and measures the opening of the throat. And I can make an appliance that we can simulate you sleeping, and we can see how you collapse, and I can make a dental appliance that you can wear at night that keeps the throat and muscles more toned. Now, if it's severe, that usually doesn't do it. So what people have done, a couple of my patients, they use the CPAP as well as the dental appliance. It sounds like a lot, but what happens is they can turn that CPAP way down so they don't get the big blast of air.